Welcome to our webinar. So good to be with you all today. My name is Michelle Branham. I'm the Vice President of Public Policy for the Alzheimer's Association in the state of Florida. Hopefully you know me by now and you've spent a lot of time here in my home with me as we've been training since March. This is an exciting opportunity really for us to talk about a very robust, very engaging state policy campaign. This year, we have a lot to share with you. And this year, we decided, since it's an unusual year, and it continues to be an unusual year, and because Florida has re-elected, and brought on a whole bunch of Alzheimer's champions, this is our year to really go with some tough and engaging and exciting, quite frankly, legislation for this year. So all of us as advocates, whether we advocate on the federal level or the state level or both, we're really asking us to lean in a lot towards the state level this year. And that's why we want to spend more time training with you and offer all the training materials. So for those of you that have been to Rally and Tally with us or the forum in DC, you'll see that this kind of training and boiling it down to the essence and bullet points really helps us to understand it and message it together. So we're starting early because the legislative session, as you guys know, we just finished up a very exciting election. So we have much to share with you about that. But this is the time to get started, folks. And this is when the messages will be very important as these new members and old members step back into their roles and orientation week begins next week. We need to continue to be on the very top of their priority list and their radars. So I wanted to tell you all about it. Today, you're going to have Jennifer Brasted with us, Jessica Sams, and of course, John Connolly. And we will have, he has pre-recorded for you. He's on vacation, Evan Holler, with us today via video. So a very exciting agenda. First, again, thank you guys so much for joining us today. As we know, Alzheimer's is a bipartisan issue, and that means that we can be very thrilled for both Republicans and Democrats that return to us or new that champion Alzheimer's and all the related causes. So thankful in Florida, we really have so much to celebrate. We ask right now that if you have any questions, we'll continue along the way and we're going to do a big Q&A at the end. But if you have any questions, thoughts, or feedback, don't hesitate to put it in the chat box. Jen and Jess and John and I will be monitoring, I say me, but really mostly them, will be monitoring the chat box and making sure we address any and all questions. And I want you to ask the really hard questions because we're going to continue to get better at messaging these priorities. They're unique, they're engaging. Like I said, they're very robust. They're more than we've ever done. So all of us need to be asking the tough questions. We need to be talking about it as often as we can so we can get really good at messaging this both to our elected officials and to each other and to leadership, quite frankly, in our communities. So without further ado, we're going to take it around the horn, around Florida, which if you guys are like me, you've been kind of following this weather pattern, which is getting weirder and weirder. I think we were talking about early this morning where the storm is going back to where it started west and south, which is unusual. So we're going to bounce around Florida like the storm is bouncing around Florida and hit Jessica Sams, who's going to share a little bit about an election recap for us in the Florida Gulf Coast area. Without further ado, Jessica.
Hi. So I have to tell you, I've really been looking forward to doing this election recap with you guys, especially for our Gulf Coast advocates. I think we had a really exciting election cycle. So I'll start with the federal level. There, all of our incumbents that were running, so if you are in a district that was represented by Soto, Webster, Bilirakis, Representative Christ, Castor, Buchanan, or Stubbe, all of them returned. And I think it's really phenomenal news for us because it's a very bipartisan bench of elected officials that have been very supportive of our issues in the past. So for those of you that live in one of those districts, I'm just going to encourage you to keep doing the good work that you're doing. And I also encourage you, no campaign is easy, whether it's victorious or not. So perhaps some of you have, but if you want to just take a minute and reach out to their staff and send them a note of congratulations, I think that would really mean a lot for them. And I will also say that we have two new members that we're focusing on in Ross Spanis District, District 15. We now have Representative Scott Franklin. Sorry about that. And he is new to politics, but he comes from a Navy background, and now he currently owns a small business in Lakeland. And the other big switch we had was in Representative Francis Rooney's district that will now be held by Byron Donalds. And Representative Donalds is a little more of a known entity to us here. He's served in the Florida House before and been supportive. So for those in that district, it's not only going to be introductory, but also just really educating him as well, and Representative Franklin, on what our federal issues are. And on our state area, we did have a lot of changes there, and I'm encouraged by that. I think one of the more exciting parts for Florida Gulf Coast is that we have a lot of leadership in our area, which is going to be really important in this upcoming session. So we have a Representative Chris Sprouse, who will serve as the Speaker of the Florida House, and then also Representative Michael Grant, who will be the House Majority Leader. We also have Representative Colin Burton, who will be serving as the Health and Human Services Chair in the House. So those are all pretty exciting updates from our area. I'm really encouraged. I think it's going to be a great 2 years in the Gulf Coast. And with that, I will hand it over to Michelle for Central and North.
Thank you so much, Jessica. And I forgot to tell you guys, so thanks, Jess. That is exciting. And there is some great leadership in the Florida Gulf Coast area. And we've got Jess all over it. So really excited. And I really want you to make sure you're asking her lots of questions and engaging. And here's one of the ways you can. Jen, I think, is going to put in the chat box a link for you. That link is to a Google Doc that all of us put together. So right after the elections, because we're political wonks and we really nerd out on all of this stuff, we put together our list of key champions all over the state of Florida. So you just heard from Jessica about Florida Gulf Coast. This Google Doc will showcase the champions. It will showcase with the elections and all the districts from federal level. It starts with the federal level. It goes down to the state level. And you'll look to see the incumbents. You'll look to see how much they won by. You'll look to see if there's any new people there. And it's all color coded. At the end of that, there's going to be hopefully 2 columns where I'd love for us to start making notes about if we know some of these elected officials, if we know some of the new ones coming in, any of the incumbents, if we know their staff. So I really encourage you, and we'll send it again on a follow-up email to you with a lot of collateral that I think will be very exciting to kind of peruse over this Google Doc so that you can start to be looking as your advocacy managers and John are talking and I'm talking to you. You can start to look through this Google Doc and see where we can make connections and where we continue to expand our champion base. We're going to need to do that. And it's important for us that the more advanced the legislation becomes, the more we decide to move the needle here in Florida, the more champions we need. So I'll ask you all to take a peek at that Google Doc. Let's see if you know any of the folks. And if you do, to make a notation and let us know how you know them. And we're happy to help follow up with you. So let me tell you a little bit about Central North Florida. So we have a lot of incumbents in Central North, and I'm really excited to tell you that all of them got to stay. The only incumbent that didn't stay is Congressman Ted Yoho. He termed out, but his seat was taken by Kat Kamek, who was his field staff person, our regional director, and got to know Kat really well, really excited about her joining us, and it's going to be a really exciting time with her. So the great news about having someone like Kat is, as a staffer for Congressman Yoho, she got to know us, she got to know the issues, she got to be really heavily involved and prioritize, and now she'll get to do that as a member of Congress. So very exciting, very exciting. So really happy about that. Also, of course, we got Representative Plagan, a super champion of the cause. He is back and won by a larger percentage points than he did in his prior election. We also have a returning champion for his last term, I believe. I think he may retire after that. I wish he wouldn't, is Congressman Rutherford. Congressman Rutherford is District 4 here in Jacksonville. He will be on Appropriations again this year, an extreme champion for the cause. So really excited about Congressman Rutherford returning. We also have President pro tempore, which is Senator Aaron Bean. And that's going to be very exciting for us because Senator Aaron Bean up in Nassau County area, just above us in Jacksonville, is a big champion of the cause and has made some real strides and continues to have leadership roles in the Senate, the state Senate. So looking forward to more work with Senator Bean. And then Colleen Burton will be joining us out of Lakeland. She will head up Health and Human Services and will be the chair of Health and Human Services. So looking forward to working with Colleen. And then hopefully, if we're lucky, Senator Stargell, who carried our dementia director bill last year, she will hopefully, and we're crossing fingers, become the Appropriations chair for the larger Appropriations Committee in the Senate. So looking forward to that as well. So a lot to be excited about. Jessica told you about the leadership in the Gulf Coast area. This is a little bit about the leadership in Central North Florida area. And with that, I'm going to pass it all the way to the South to Jen Bracestead. Jen?
Thanks so much, Michelle. So I hope everybody is doing well, and especially all of my South Florida peeps. I hope you're not flooded in or dealing with wind damage. I thought I made it through. I actually lost power last night, but here I am. And fortunate, I live in the tallest area in my city, just over 1 foot above sea level. So luckily I don't have a lot of flooding, but of course, as strange as that sounds, that's typical for South Florida. So we had a very interesting election night. You know, the two big congressional changes where we actually had two incumbents in Miami-Dade County lose their seats. So that was Congresswoman Debbie Mercuzzo-Powell, who was District 26, which covered Kendall and also Monroe County, so the Keys. And then Congresswoman Donna Shalala, who was the only member to actually cover all of only Miami-Dade County. That was Coral Gables, Little Havana, and the beaches. And she lost her seat as well. They were both first-term congresswomen. You know, they were both very supportive of our issues. Congresswoman Mercuzzo-Powell did co-sponsor, and Congresswoman Shalala was really, with her healthcare background, very much a champion for us. So these are losses, but you know, we're optimistic, and actually the current mayor of Miami-Dade County, Carlos Jimenez, is going to be taking over for District 26 as Congressman-elect. He has been a champion for seniors. Of course, we know that Miami-Dade County has the highest number of seniors, and of course, individuals living with Alzheimer's with disease, which is just over 60,000 individuals with a diagnosis within the county. He has worked with us as an association on some campaigns to raise awareness with the Metro Rails and things. So, you know, we do have that going in. So hopefully with the amazing work of our advocates, we'll be able to really make some positive strides. And then for District 27, it is Congresswoman-elect Maria Elvira Salazar, who is a former television anchor. We haven't been able to engage with her, whether it was in the past on her previous campaign. She did run in 2018. So we don't really know her background and her experience with healthcare, but looking forward to engaging. And of course, we have some of the most amazing advocates in that area and a great congressional team. So I know they're going to do wonders. And on a state level, we did see that some of our champions were reelected. So Representative Matt Wilhite, he did win his reelection very strongly. So that's very exciting. Also, we did see a lot of champions in the House, Representative Tina Polsky and Representative Ana Maria Rodriguez. They actually won their Senate seats they were running for. So we especially look forward to working with Senator-elect Tina Polsky and Senator Rodriguez as well. We do have 11 new legislators in South Florida, covering from the Treasure Coast down to the Keys. So we look forward to engaging with them. And finally, you know, because we are South Florida, Miami-Dade, we only had one real situation with a recount, and we talk about how every vote matters, and it does. So for State Senator Jose Javier Rodriguez, he actually is in the middle of a recount, which started today. With Ileana Garcia for that state Senate race, and she is actually in the lead by only 20 votes. So we've seen how tight some of these races have been across the country, and this one is no different. So the recount is currently going on, so we'll see how that progresses. And with that, I'm going to turn it over to our Director of State Affairs, John Connolly, who will talk a little bit more about election recap and also talk about what's to come for session. John?
There we go. Can you hear me now? No. Good morning, everybody. Well, despite an uncertain election elsewhere in the nation, I must say it's great to be a Floridian. Having lived through the drama that was the 2000 presidential election here in Tallahassee, I'm glad for once we seem to have gotten things right in the Sunshine State. As you heard from our regional public policy managers, Tuesday's election did have some upsets, but the dynamics of what we face here in Florida from the political perspective didn't really change. At the state level, prior to the election, Republicans controlled the governor's mansion, the House, and the Florida Senate. After last Tuesday's race, that is still the case. And despite the news of close, contentious election results in other states, as you heard from Jen, only one race that has yet been decided in the state, and that's the Senate District 37 race in Miami. That race, as she mentioned, is going through a recount as we speak. And Democratic incumbent Jose Rodriguez is trailing the Republican Elenia Garcias by 20 votes in a district with 215,000 votes cast. So stay tuned for that one. Now that the election is over, the legislature can get back to the business of the state. Next week, they will convene in Tallahassee for what we call an orientational session, where new leadership and all those new members that we discussed will be formally sworn in. Incoming Speaker Chris Sprawls, as Jessica mentioned, is from Clearwater, and President Wilton Simpson, who represents Citrus, Hernando, and Pasco counties, will take the reins of their respective chambers on Tuesday. The orientational session will be on COVID lockdown, and the state capitol, for I think the first time in our state's history, when not in wartime, will be closed to the public. I'm not really looking forward to that, to be honest, but all the activities should be broadcast live on the Florida channel, or so it's planned. For us, we are working to schedule discussions with potential bill sponsors for our 2020 legislative proposals and are looking forward to getting back into the trenches on behalf of you all and the thousands of Floridians impacted by Alzheimer's disease. After next week's orientational session, I'm a little disappointed, but there will be no plans for the legislature to return to Tallahassee before January, other than the House will be holding what they call Legislative University, where all the new staff and members come to Tallahassee and kind of learn the process. Both bodies, the House and Senate, will return the week of January 11th to officially start their interim committee process. The interim committee process will occur every other week right up until the beginning of the 2021 legislative session, which starts in March next year. Between now and January, your public policy team will also be attending as many of the local legislative delegation meetings as we can and presenting our legislative agenda to the local delegations. We are excited to share our proposals to expand Alzheimer's disease and related dementia training for direct care workers, as well as professional medical personnel, which you'll hear about in a little bit later. At this point, it's anyone's guess how things will look in 2021. And I, for one, sure hope it's a much better year than 2020. But with a robust legislative agenda, we are pushing forward in a very aggressive way, continuing our efforts to push for public policy changes that make a real impact on individuals, families, and caregivers of those impacted by Alzheimer's disease. Michelle, I'll pass it back to you.
Thanks, John. You know, I was talking with Congressman Rutherford's Health Legislative Affairs person, Lizzie Messer, and I think some of you guys have met her on our webinar. She was saying, I hope 2021 is a boring year. Isn't that fun? Because I thought, yeah, you know, so it was just boring. Boring is going to be good. Getting through doing the right work that we can do. So maybe boring would be okay, right? But to tell you the truth, on the state level, as John suggested, it's going to be anything but boring. I think part of the thing that's going to be hard for us, and we're going to continue to work on and monitor, and you see your team is really at the edge of their seats, ready to go. And as I know you guys are too, is how we get in there, how we do this work. And we'll continue to work on the side and research and do all the things that we need to do to just really determine how to best get to these legislators and the folks that we talked about that are newly elected, the folks that have been there for years. This will be key for us, is just getting in front of them, just getting the priorities out there, while we all try to figure out what 2021 is going to look like, how this session will look, as John indicated. But rest assured that this team is spending a lot of time really, like I said, on the edge of our seats, trying to anticipate and be prepared for every twist and turn that might be this session this year. So John talked about it. I've talked about it. This priority agenda, last year we did dementia director and we had the brain bus. This year we have brain bus like we always do. But this year we are going to really dive in and try to enhance and update the training requirements for a lot of different industries here in Florida. And that is a game changer. That is a needle mover, folks. That and working with medical licensing to ensure that we include Alzheimer's disease and related dementia in medical licensing. These are big, tall orders in the state. And you can imagine some of the obstacles that we'll face and we'll run into. So that's why we're going to not only be prepared, but be over prepared. And that's why we wanted to share all of this with you. And we're going to keep sharing it like we would do, like I said, with the DC Forum, where we would continue to train, boil these down to the essences of them, get them down to talking points and bullet points so that we all feel really comfortable talking about these new priorities. So I'm going to pass it back to Jen and John, who are going to tell you more about the priorities, but we're also going to make sure that you have collateral and want you to spend time, because we want to keep you engaged, keep you excited, because these are going to be, we say unusual, weird, but I think these are going to be exciting times for us in the world of Alzheimer's disease. I think we have a lot to accomplish, and we figured this year is going to be weird, so why not go big, right? So we've been working hard since what, Jen, about May?
Yeah.
Building on these legislative agenda. So without further ado, I'm passing it back to my colleague who is going to tell you about a tough, tall order that we're excited to work on this year in medical licensing. Jen?
Thanks so much, Michelle. And I am so excited to talk to you all about one of our most aggressive policies we've ever attempted before. But as you all know, the Alzheimer's Association every year releases our facts and figures report. This comes out in March. Of course, we had COVID this year, so I feel like we lost a little bit of that momentum, because facts and figures is always it's a big deal for all of us here, especially us policy people. And I know our advocates, you all love facts and figures too, and always want to know the new numbers. But in this year's report, there was a special report that we have every year, and this focused on primary care physicians and Alzheimer's care across the country. And 82% of primary care physicians say that they are on the front lines of dementia, but we all know that they do not have adequate training. And 40% of those primary care physicians say that they learned the most about Alzheimer's disease and related dementias through continuing medical education. So with that said, that is where we are going to put our energy. And so we are working to actually establish and enhance training for medical professionals. So our proposal is that we are proposing 2 hours of continuing education related to Alzheimer's disease and related professionals for medical professionals such as nurses, CNAs, doctors, physicians, physician's assistants, nurse practitioners. And they would actually complete these continuing educations through their relicensure process. So we are very excited about this. We cannot wait to keep going with this. And if you have any questions about specifics about this proposal, please put it in the Q&A or the chat box. We will be doing a Q&A. And with that, I'm going to turn it back over to Michelle.
Sorry, my mute wouldn't come off. So you at least need one of those in a webinar, right, Jen? You need one mute not coming off. But so Jen put it so eloquently, but the truth is this is going to be really tough, guys. Part of that, why it will be tough, is anytime you're working with medical licensures, they have 40 hours of when they have to renew their license, there's 40 hours of continuing ed that they have to do. So getting Alzheimer's inserted in there, it's something that we've done for HIV, AIDS, it's something we've done for domestic violence, and we're trying to move Alzheimer's disease and related dementia to be part of that 40 hours. So it's a tall order because medical licensures, no one likes to have that messed with. Nobody loves the idea of doing more and more and more training, and nobody loves the idea of thinking that they'll have to do more training. So it's going to be in order for us to get our ADRD training into that 40 hours, just like we've done with HIV AIDS. So sort of built off of that model, if you had any questions about that. But I'm really excited about this. We've run it by our programs team, our vice president of programs and our programs director. They're excited about this one. If we're going to shoot, we always shoot for getting something done in that session. So if we introduce it in the session, we're hoping it happens in the session. But this one could take some time, and we're in it for the long game, aren't we, Jen? So we are. So thank you so much. Next, I'm going to pass it back over to John Connolly, who's going to talk to you about ADRD, Alzheimer's disease and related dementia. So if we hit acronyms that you guys don't know, please don't hesitate to ask what they are, because the government loves their acronyms. We love abbreviations and acronyms. So we apologize if we talk in them. No, we don't. We apologize if we talk in them too much. So always ask a question. So John's going to talk to us about training and appropriations. And with that, I will hand it back to you, John. Thank you.
Well, thanks, Michelle. As Jen mentioned, this year's legislative agenda will focus on training. In addition to creating new training requirements for medical professionals, we will be advocating for the creation of a single, uniformed, and streamlined training requirement for all staff who work in assisted living facilities, nursing homes, adult daycare, hospice, and home health agencies. This proposal will create an initial 1 hour of Alzheimer's disease and related dementia training for all staff upon being hired. Then we will require an additional 3 hours of ADRD training for direct care workers in these settings. These direct care workers are the ones that provide the care for the residents and clients. We also are including an additional number of hours of training for direct care workers, specifically in assisted living, adult daycare, and nursing, for a total of 8 hours upon hire for direct care staff in those specialized settings. And finally, just like with the continuing education for medical staff, we feel that getting this continuing education training every year is vital, because things change, policies change. And so for the direct care staff in these settings, we will be requiring all direct care staff to receive 4 hours of continuing education every year, specific to Alzheimer's in the, again, ALFs, nursing homes, adult daycare, hospice, and home health agencies. I want to talk a little bit about appropriations. And obviously, as a result of COVID, we're expecting a very lean year next year. The state is expecting an over $2 billion shortfall in tax revenues as a result of all the impact of COVID. And as such, the legislature will be starting with what they call a zero-based budgeting process, which basically means everything that is not considered a basic function of government will be cut from the budget. And we'll have to fight to get those issues back in. This unfortunately means issues like the brain bus will be cut out of the budget, and we'll have to fight to reestablish that for 2021. We also will be advocating for the state to maintain current levels of funding for research in the EdNFA research program, as well as be asking for new dollars, which will be a tough fight, but for something called the Behavioral Risk Factor Surveillance System, or BRFIS, which is a survey that is used to shape programs and policies that promote cognitive health and address cognitive decline. We'll also be working to maintain funding with the ADI program, Community Care for the Elderly, and our usual ask as well. we also just expect it to be a tough session. Like I said, it's going to be lean, but we are pushing forward again with a very robust agenda, and I'm excited personally to kind of go for broke and see what we accomplish. But we'll see what 2021 has to bring. So, Michelle.
Thanks, John. We are certainly going to keep you busy this year in Tallahassee for sure. If you don't mind too, John, while we're at it, for you and Jen to check out the chat box, there's been some great questions and I really appreciate that. Continue to ask. Like I said, in the chat box, and I'm typing and listening at the same time, so I hope I'm getting it right. But we will be sending little fact sheets. Also a really cool, my favorite piece of collateral that we have right now is this grid. And this grid kind of tells if we have assisted living facilities, skilled nursing facilities, adult day, hospice, and home health agencies. And the grid and all the training that John just talked about will touch each one of these areas. So the grid kind of shows you what currently we have now in Florida for all of these different areas of healthcare and what we're proposing. So I kind of love the grid for a layman like myself to see where we are and where we propose we want to go. So I know Vicki Rose and Rona asked some really good questions about that too. We also have a one sheeter. I say one, it's a front and back sheet on the ADRD training. Again, what statutes we're touching. John mentioned, and I think it bears repeating too, that this is a unifying thing. So there's different statutes that cover all of those areas I just shared with you. We're going to unify it under one statute. So we're actually writing some law in here, writing a new statute, and kind of hoping that we can sort of collapse the other ones into this and enhance, update the training. Also, Vicki Rose asked a great question as well about the curriculum. Currently, Vicki, that training is under your USF, has a contract with the Department of Elder Affairs, and all the training curriculum is going through them. But the legislation that we're proposing will offer opportunity for the Department of Health to enhance or update that training if needed. So John can also answer some of that at the Q&A and in the chat box as well. So thanks for all the great questions. Also, I wanted you're not getting to see Evan today in person. Well, and nothing's in person right now, but you're not going to get to see him live, but he did want to spend a little time with us. So Jen videoed him this week before he left to talk to you a little bit about becoming a state champion. We're asking you if you aren't already to be a state champion, and why, Jen, why are we asking this year? Why is it so important this year to be a state champion?
Well, as you just heard from myself and John and Michelle, we have our most aggressive policy platform, and we have a lot of tough asks, and we are not going to be able to move that needle without your help and without building those relationships. We know that we can do so much, and we know that we have a new platform now. We have a new state legislature. We have, just in South Florida, over 11 new members. We have a lot of work to do. We have to build these inroads, and we know we can accomplish so much. We've gotten a dementia director. We've strengthened the Alzheimer's Disease Advisory Committee, but our work has just begun. So we need you, and we need your voices more than ever.
Jen is so right. And from some of the chats that you see, some of the questions like Vicki is asking about funding, this is going to be a really tough year for funding. I mean, we're starting with zero, as John mentioned. Not to scare you, because we kind of always do. The reoccurring funding is not really a thing in Florida anymore. So we end up having to start where we always do, is at the beginning, for things like Brain Bus and community care for the elderly and Alzheimer's disease initiative. So through the legislative budget requests that go through the Department of Elder Affairs, it's a lean year, but that doesn't mean that's just an original place to start. It doesn't mean we aren't going to really go for all the things that we care and steward the money that we care about, and that includes ADI funding, CCE funding, Vicki, and Ed and Ethel Moore research funding. We will always be extremely supportive and make sure that we're maintaining appropriate funding levels for all of those really important programs. So that's something that stays on our agenda every year, no matter what. So even if we're going to add some aggressive stuff like we will always have respite care funding through CCE which is Community Care for the Elderly, ADI, which is Alzheimer's Disease Initiative here in Florida, and the Ed and Ethel Moore Research Program. So all of that, we will always be working to maintain funding or increase funding there. So all that being said, Jen, can you queue up Evan for us?
Absolutely. It wouldn't be a public policy webinar if we didn't have Evan. So with that, I bring to you Evan Holler.
Hey everyone, my name is Evan Holler and I'm the Public Policy Manager for the Central and North Florida chapter of the Alzheimer's Association. And I'm so glad you are all here with us today to discuss our upcoming state priorities and learn more about our State Champions program. Some of you have already been advocating on the state level over the past year and have taken the pledge to join this wonderful program to help advocate for all families impacted by Alzheimer's disease across the state of Florida. The State Champions program is designed to help advocates work with their respective public policy managers to help engage elected officials in the Florida House and Senate. During a normal year, not hindered by a pandemic, we would be engaging our elected officials in person by sharing our personal stories and educating them on our state level priorities, which all of you are learning on the call today. We also host our state advocacy days, where those who have taken the pledge as a state champion can join us in Tallahassee for an incredible purple lighting ceremony and training session with our public policy team. This year may look a little different, but after revealing our most substantial priorities platform ever put into motion by your public policy team, it is crucial now more than ever to engage our officials, even if that's virtually for the year. And we ask, if you have not done so already, please consider officially joining the Florida State Champions program by signing up on the AIM portal. One of our public policy managers will be putting that link into the chat box now. And if you have any questions, please do not hesitate to reach out to any of us directly. We have Jessica Sams in Florida Gulf Coast, Jennifer Brayson in Southeast Florida, and myself in the Central and North Florida chapter. Enjoy the rest of the webinar, everyone, and I'm going to pass it back over to you, Michelle. Thank you.
Oh, Ev, we miss you. So, Evan, I was saying every once in a while we give people a vacation here. So Evan is on a couple of days off, but I'm so glad he could be with us. There is a question, John Connolly, I was going to tell you from Steve Waterhouse in our Q&A section. So I was going to have you take a quick peek at that. Also, I'm going to pass it back to Jen for just a second. She's going to talk. So Evan in his video was talking about being a state champion. So everybody on this call, there's 42 of us here today. Let's all be state champions. Let's make sure we're state champions. We need you to be state champions. We're asking you to really engage now, which is great because we can't be together personally. We can't be in Tallahassee right now. We can't be at Forum, but we can be doing stuff, working together to really, like I said, move the needle. And you've been hearing from everybody today about how we're going to do that. So Jen's going to tell us a little bit about how to formally be a state champion. Jen?
Thanks so much, Michelle. So I think the best way to do this is to actually show you how to fill out the application on our AIM portal. It's very quick. It's very easy. Many of you may be familiar with our AIM website, but you know, I love a good visual and I hope you do as well. So this is, and I will put the link in the chat, but this is our AIM website. It's allsimpact.org. It's a great user-friendly site. And what you'll do is you'll go to Take Action. Many of you probably are familiar with the reporting in action, but if you haven't already, you will go to Become an Advocacy Volunteer. And you will actually fill out this quick application. You can kind of identify what your interests are, whether it's working on social media, whether it's meeting with elected officials, working on letters to the editor, supporting the Alzheimer's impact movement, whatever your interest is, just talking a little bit about your story. You don't need to, you know, go into too much detail there. And then, you know, how did you hear about us? But anyways, just, you know, brief information, name, address, email, Twitter handle, if you do use social media, your address, your city, your zip code. All of this information is critical because then we can actually find out who your elected officials are. So then once you complete this, we will actually get within our system in the back end, the public policy managers will be notified, and we will actually be able to identify who your specific officials are, your state senator and your state representative. From there, we can actually assign you the role of state champion. Once that is assigned, you will get another email for you to take the advocacy pledge. That is just, making sure you're official and you're going to work on all these incredibly difficult but fulfilling policies that we're going to be working on. Which you all are. And so once that's completed, you're officially in our system and you're officially an Alzheimer's Association state champion. We will actually send that link out. I'll put it in the chat right now too. And then once you've completed that, we will actually work with you individually, your public policy manager, to make sure you have completed that pledge and you are in the system and you're all set. And we'll walk through that with you step by step. But, like you just saw, it is a very easy, process.
So Jen, I have a couple questions for you.
Sure.
One, we're all on the call, so you guys look, we're all in. So we know we can just be state champions. Taking that pledge is just that little extra step. So don't forget to take the pledge, because a lot of people sign up, do awesome, do that quick little sign up, and then forget to click yes and take the pledge. The pledge is important because they really want to build these state champion programs. Florida has one of the biggest in the country already. Let's make it the biggest. We can beat out Illinois. We can certainly beat out California and make it the biggest. But this is where we really need your advocacy right now, is on the state level. So as Jen said, this is the time to kind of go all in. And I promise you guys, as we know, federally speaking, there's not a whole lot going on the federal level right now. We've done some great work. We got the elder justice bill passed, and that's going into law. So you guys have hit some great big marks with BOLD and elder justice on the federal level. Right now, we're going to just kind of pivot and hit the state level for advocacy, especially when all these new members are coming on, or they're incumbent members and they're excited, they're enthusiastic. They just came off a big campaign. There's a lot going on, and this is the energizing time to get them. So now we're going through delegation meetings that'll start to pop up. And sometimes you guys have been on those delegation meetings. This year, because of the protocols for the Alzheimer's Association, the staff, us, will have to do those delegation meetings, but we'll be working with you to let you know when we do them and if they're in your area. So, and if you know anybody that's on the delegation meeting. But the question for you, Jen, so how do we know if we've signed up already? So Vicki Rose asked a great question. So not sure if she signed up.
Yes. So I'm pretty sure that you are signed up, Vicki. And I did see another question from John Catugno that said, if you've already registered and you have, do you have to sign up again? And the answer is no. Once you've signed up, you are a state champion and you are all set. So John, you are completely official. Congratulations.
If you're taking the pledge, super official, but you guys have already pledged your advocacy and done incredible work with us. So like I said, now we're just leaning more into the state level stuff, as Jen and John and I have talked to you about. So make sure you fill out the thing if you haven't. If you're not sure, check with your advocacy manager. It's just a quick look up to see if you are. And then make sure when you get the email, you click yes and you take the pledge, and that should handle everybody. So we're going to share the link. Someone just asked me if we could share the link, Jen, to the AIM portal.
Absolutely, we will do that.
We are doing.
I'm just looking, and Vicki, you are a state champion, so you are official. So it's really, I believe if you visit the AIM portal often and you report a lot, you're able to see your status. But if not, don't worry, your policy manager knows and can look that up very quickly. So, and I will put that link in the chat right now.
And Dad, I'm asking you, my dad texted me and said he's on the call. Hey, Daddy, I love you. So like I put you all in for everything, Dad, we're going to make you a state champion too. So I'll check to see. Jen, you got to check and see if he's a champion too.
I will certainly do that for you.
Thank you so much. Yeah, thanks for all the support as always. I love you so much. Okay. So listen, I think, and tell me, Jen, I want to share a little bit about what we're going, what's coming up for us, because we have some thank yous ahead for you guys. And then I wanted to see if we wanted to spend a little bit of time in Q&A and talk about some of these things that we just talked about. This is the time to ask some hard questions and not feel bad about asking the tough questions, because if we can't get this by you, how are we going to get it by our elected officials? Do you know what I mean? So it's important that we poke holes in some of this, ask all the good questions, beat it up a little bit, make sure we're super prepared, uber prepared to get our sponsors, because that's our next step, is to make sure we have sponsors for all the legislation, file the bill, pass some laws, I hope, and change the moment, continue to build on the momentum and change the complexion of Florida for training and licensing. So some very exciting, and of course, the most important things that we do that are continuing brain bus research, respite care, and the like. And as John mentioned, the BRFSS, which is BRFS lovingly for short, which is a survey that we do across the state to help us collect data for caregivers and people with cognitive impairment as well. So it's a really good data analysis for us that the CDC compiles. So we've got everybody on. We're ready to talk about, so Jen, first, before we go to Q&A, can you tell us a little bit about what's coming up?
Yeah, absolutely. You know, before we get into some upcoming events, you know, we'll mention that, you know, one thing that you can do once you've taken that pledge and signed up as a state champion, and there were a couple questions about, will this be sent out? Is this being recorded? One, this is being recorded. We're on Facebook Live right now as well, so you can check it out later. And also, we will be sending out a follow-up email with the link, and also all of those infographics we were talking about, and that training matrix, and all kinds of great resources for you. And also, we'll be doing a phone to action where you'll get that link as well a little bit later this afternoon, so you'll get that as well. But one thing we want is, while, you know, they're getting ready for their orientation meeting next week, we really want you to reach out and to congratulate your official. So once we get you signed up and you know who your official is, or if you've worked with them in the past, you know, we want you to reach out, just congratulate them. If they know you, of course, it's just that reconnection. You know, of course, we haven't been in session since March, and, you know, a lot has happened since March, as we all know. And it's time to really reconnect with our officials, and those who are brand new, you really want to introduce yourself as their constituent and talk about your story and why this cause is so passionate to you, and how you'll be reaching out to them soon to get information. So, you know, reach out, work with your public policy managers. We can get you, you know, their emails, their contact information, and give you some talking points if you need help with structuring how you want to do that initial reach out. But we want to do that in the next coming weeks to really, you know, set that ground for the upcoming delegation meetings, and also for committee weeks that'll start in the beginning of 2021, and then of course session. And with that, I'm just going to share a couple of events that are coming up with the beautiful PowerPoint. So here we go. So we have a couple different things that we have occurring over the next couple weeks. So one, of course, we all know that our Walk to End Alzheimer's season is still going strong. I know in South Florida, we're really diving into our season. We have 2 big walks just this upcoming weekend that we're all looking forward to. But this year, we've actually launched a campaign. It's the Tree of Hope. And so many of you have probably seen these before, where, you know, a facility or a venue, a hotel, a business, they have a tree, and then they ask for donations. So we want everyone to get really creative with this season. So whether it's an amazing palm tree you have in your backyard, like I do, or, you know, it's a little, you know, 2-foot tree that you have, we want you to decorate that and get donations. You know, and if you know any businesses that have real high traffic areas, this is a great way for them to get involved as well. This is a campaign that's going on across the state. So if you are interested in learning more, or having your business or your community really have a Tree of Hope, reach out to your walk manager or director, and they can give you more information on this. It's such a a beautiful idea. And as we go into the holiday season, which I know we are all looking forward to this year, I know I am, I think this is just a great way to continue to raise awareness and gain momentum for our cause. Another thing is that December 8th, we will be hosting a breakfast of champions with our president and CEO, Harry Johns. This is for anyone for the Walked In Alzheimer's who is a champion. That is someone who has individually raised over $500. You have your champions, your grand champions who've raised over $1,000, and then your elite grand champions. So that is open to anybody. Invitations will be coming out, but if you haven't reached that $500 yet benchmark, you know, it's a great opportunity to really have that one-on-one connection with our CEO, Harry Johns. There's a lot going on with research and policy and programs and care and support. So it's a really an amazing opportunity for you to have that connection with Harry. And he's always a great speaker and always really engaging, and someone everyone always wants to hear from. And then finally, we are so excited. Please save the date. Tuesday, November 24th, we are going to host a virtual Thanksgiving.
Mark it on your calendars, guys, because we're going to
mark it on your calendars. 11 a.m. Eastern time, 10 a.m. Central time. This is going to be a great event.
Jen, any of us? Seriously. Is there any? I want you to put it in the chat box if you're Central Time. We want to know where we
do. We're but we love our Central Time. You guys are keeping me on my toes, and I'm learning new math, and it's really great. But we are so excited. This is just going to be all fun, and it's going to be celebrating you, because in this year of turmoil and chaos and unknown, I know for personally, the work that we've done and working with all of you has really grounded me and truly been a pillar for me. And so I cannot wait to celebrate with you. I might have to get a turkey head for the festive occasion. I'm really excited. We'll be sending out more, but we wanted to share with you all first. November 24th, virtual Thanksgiving luncheon. Don't miss it. So with that, I will turn it back to you, Michelle.
Yeah, please be with us for that, guys, because one, Thanksgiving, we're so goofy this way, but we mean it sincerely. We're all pretty emotional about the grounding that you give us. And this is how we press forward. And this is how Jen says we breathe life into what we're doing each day is really because you're here. So not getting to be with you all personally and in person is tough on us, because it's where we really thrive. And it's really where we gain a lot of our energy and momentum is through you and all the courageous, amazing, brave work that you do all year long. And I say that with so much just genuine authenticity and thanks. So this year, 2020 and its craziness, we are thankful most specifically just for you guys. So this Thanksgiving dinner is really, or our lunch is really just about thanking you, spending some time laughing, and hopefully eating some good food that we won't be able to smell your food because I love all the aromas of Thanksgiving. So I'm gonna have to make Jeb cook me something so that we can at least be here together, eating together, communing together. And we are sending you guys out just a little something just to say thanks, that we love you and we appreciate you. And this year, now more than ever, we are so very thankful for you. Just thankful for you, the mission, and each other. So yes, please join us. So thank you, Jen, for sharing all of that great information. Yes, it says our volunteers the best. Thank you, Urissa. They are the best. They are the very best. And I just can't begin to thank you all enough. So we'll continue to spend this month thanking you in all the ways that we can. Also, Dawn Wade asked if we can put this on YouTube, and yeah, we can, right, Jen? I say yes. I'm agreeing to it.
The person who would put it on YouTube is Dawn Wade, so the idea that she's asking this is kind of funny, but
I know.
Yeah, Dawn, if you'll do it for us, then yes, we will put it on YouTube.
Love you, Dawn. Yes.
I just want you to give me the file.
Yeah, give us the file.
Yeah, that's done. I will give you the file.
Oh,
Yeah.
that we've been on lockdown since March by virtue of the fact that we're laughing with you all today. We spent a lot of time on Zoom. In fact, yesterday was just all the Zoom mishaps. One of us sent an inspiration, and it was so cute looking at all the Zoom mishaps. You guys have yet to see cats and dogs running across yet. We haven't gotten any of those good Zoom mishaps just yet. Hopefully there'll be some to come. Maybe John's dog Danica will pop into the picture somewhere. So if you guys have questions, now we're just going to open it up for the last couple of minutes to questions for you. Also, to make sure that you know that we have some beautiful, speaking of Don Way, beautiful collateral that is coming your way. And we are going to email everybody that was on the call collateral that, like I said, boils everything down to the essence of it. So we don't need you to be super legislative experts. We just want you to be able to be state champions with us. Jen is smiling. Did you see something in the chat box, Jen? Or are you just waiting for Danica?
I did. No, Laura, who's joining us, she's Corey LeMay's aunt, and Corey used to work with us down here in Southeast Florida. So thinking about Corey made me smile. So I'm saying hello back to her.
Great. Yes. Hello from all of us. Again, you will see these fact sheets, and I think they'll be great for us to really boil, like I said, boil the essence of everything down so that we don't have to feel like we're legislative experts on anything. We'll leave the legislative expertise up to John and Jen, and I say me, sometimes I'm an expert on it, sometimes I'm not sure. Anyway, and I think that will, all of those questions that you have for that, but I think those fact sheets are going to be really, really helpful. Like I said, I think the grid that we created, right, John, will be really helpful. Anything you wanted to add to that, John?
No, I think we covered everything pretty well. I mean, obviously, these are complicated issues, and we will, mainly we do it for the legislators. We try and parse it down to the most simplistic format so they can understand. And, we'll be here throughout the process, and as we work through things from our end, it will give us tools that we can share with you that you can use as well. And that's part of what this process is. It's a very collaborative process. So, I am here in Tallahassee, but just because I'm here doesn't mean that what we need to accomplish gets or is accomplished here alone. And it is a truly collaborative process. And so as we learn lessons by, introducing this legislation to potential sponsors, we'll get questions and we can tweak things and tweak our arguments, and we'll share that with you as well. So I think as this process goes, it's no different than any other year. But I think, in the light of all that we're dealing with, both personally, professionally, and as a country, I think that, we have to be very flexible in how we present things. And so that's why we're here today, to talk to you and get you guys engaged so that we can lean on you and engage the members of the legislature back in their home communities, because ultimately that is the most effective way. I'm limited to interaction with them when they're here in Tallahassee. You guys get the opportunity to see them at the grocery, at dinners, in the community, and that is when they're most accessible, and that's how we're going to be successful. So no, I just will leave you with the thanks, and I look forward to what we can all accomplish together, because it will truly be a collaborative effort this year.
Yeah, and John's right. So John too, I think Steve put some more questions in the Q&A for you to take a peek at, but John's right. This year it's going to happen in the field. A lot more so than, and we'll lean into the field and like John said, in our own communities, because Tallahassee, as you see by virtue of the orientation week, it's still closed off to some extent. The legislators will be there, but they're not taking meetings. They're not bringing staff, at least not for next week. And that's going to continue to change like everything. It just continues to unfold, and we'll continue to monitor it, plan for every scenario that we can, whether it's getting to meet there in person, whether it's catching them on their way to their car, or quite frankly, on their way back into the Capitol if we have to. But those are going to be the kind of flexibility and how we're going to have to adapt to the reality we're in right now. And that's okay, because this reality keeps unfolding. But the good news is we're in it together, and we're monitoring every step of the way we meet as a team, sometimes twice a week. Like I said, more time on Zoom than I can tell you, more time than we want, right, guys? But the truth is, the reason why is there's a lot of planning when you don't know exactly how this is going to go down, and you have to plan for every single scenario you can think of. So it requires, not only are we carrying way more legislation than we ever have this year, but we have to plan for several different scenarios and the way that that will go down. So the thing I will tell you is make sure, and we have the link, and we'll send it again in our follow-up email. So the link to become a state champion is going to be vital for us this year. Taking the pledge right after you get that link and you fill out everything and you do all that, is you'll get an email and you'll take that pledge. And then, if you don't mind, spend a little bit of time with the great collateral that Jen and John and Evan and Jessica and I have built together for you. We've tried to make it as user-friendly as possible for all of us, for our elected officials, for ourselves, for our staff, and for you, so that we can really get into this. So ask the tough questions when you get it. It won't take you long to look over it, I promise. Check out that grid that I've been talking about. See if it makes sense to you too. Like John said, we can keep tinkering with the process because we've introduced this to you so early on. And that will be key, because we will have to get better and better and better at this as we go, and continue to fine tune as we go, so that in January we are ready to go. So that is why you're seeing a lot of this and having these big conversations right now. So all of it's going to come to you. We are going to say thank you for coming to Thanksgiving lunch, so that we can properly celebrate you and be grateful and thank you and be blessed for you. So thank you for coming to that, because I'm going to say you have to come. We want you to come. Be there. And then I don't know, does anybody else have anything else to say before we close it out? Because I would like to keep it on the hour for you guys. I appreciate you spending your lunchtime with us, and just the hour with us has been so critical, and will continue to help us build. So thank you so much for being with us today. Thank you so much from this staff who, like I said, we thrive off of you. We build our energy off of you. We're incredibly grateful for you, and we'll continue to pop in for Thanksgiving to say thank you, but we'll keep popping in to train together, so that we're so good at this that Florida is the leader in the country, like I know that we are and will continue to be. So I just want to say thanks to everyone. If you have any questions, make sure you follow up. We want to say a special happy birthday to our Director of State Affairs, John. He's got a big birthday coming up. So say happy birthday to him, everybody. And with that, we will see you November, Jen. What's the date?
24th,
24th.
11 a.m.
I had to ask, because I was like,
11 a.m. Eastern time, 10 a.m. Central time.
Did
Please
anybody
join us.
come up and say they were on Central Time with us? Because we are policy people, so these time zones get us so confused.
So confused.
It's confusing. Jen said advanced math. It's not really. We're being silly, but yeah. So I know the Panhandle has some Central Time. So as Jen said,
it is advanced for me.
Try living right on the cusp of that. You know,
right.
we can have a quiz. If you need to be in the Panhandle by 9 and you leave at 10. How long will it take you? Or what time will you return home? So
Don Wade says that we are representing the whole state, so we need to
buck up, is what she's saying. So yes, we buck up and we embrace and love all of our central.
We do.
Love you all so much.
But thank you all.
Yes, and John, you got a whole bunch of happy birthdays in the chat box. So lots of great birthday love to you. Thank you guys so much for being here. Look forward to all the collateral coming your way. Any questions you have, don't hesitate to ask. And like we always say, from our homes until we can be with you in person, from our homes to you. Thanks so much. Have a great day. And we look forward to seeing you again real soon.